Welcome back, everyone. We were talking with the Executive Director of the Tennessee Pharmacists Association, Anthony Pudlo, and talking all things pharmacy. And it's been an interesting discussion, learning all about this stuff. And I want to ask important questions you should ask your pharmacist. Maybe people don't know what they should ask, what they can ask. What would you recommend?
Oh, there's lots of questions. And hopefully, I would say, as you are going to your local pharmacy, you're not just quickly signing away the notice of I don't have any questions for the pharmacist. But you know, I do think there are a lot of important questions. Pharmacists are trained to help you best use your medications. And so yes, first and foremost, you know, make sure that you have a good understanding of what the medication is used for. So plain and simply, what is my medication being used for? If you don't know, there's a lot of medications that you get your patient leaflet that has a whole lot of information in there, but they'll list a lot of different purposes for a medication, and some medications are used for a lot of different things. So making sure you have a good understanding of what it's being used for and what to expect with using it. So whether that means what types of side effects to experience with it. A lot of medications, they are altering systems in your body a little bit. So what should you expect with using it? How often to take, make sure you understand those simple basic instructions, but also I think what a lot of times patients may not always understand is how long should I be using this for? Sometimes that conversation is not always well understood with your prescriber, and so how long should you be using this for? Maybe if it's a simple antibiotic, you kind of know how often that should be used for, but yeah, there's sometimes it's unknown how long you should be using things. What to do when you're done using this medication, or if you happen to miss a dose. There's some medications you don't want to be doubling up on your doses. You need to just skip that dose and move to the next one. So understanding that with the conversation with your pharmacist, to understand we are all people, we forget to use our medications at times, and so how best to address that situation if you miss a dose. But ultimately, I think what to do if you have extra medication laying around the house. How do you properly dispose of medications, or even just store your medications securely? What are some mechanisms and tips and tricks that maybe your local pharmacist can have? So those are a couple that I might offer as some good conversation starters with your local pharmacist if you haven't had that. But definitely, I might add this is probably the best question is just what's your name? Make sure you get to know your pharmacist, who they are, what their name is, some of the other staff members that are supporting them to better take care of you. Get to know them. They're there to serve you.
That's great. What's your name? And you are a pharmacist.
I am. Yes.
So you were behind the counter and you did all that.
I did that for a few years. Yes, I was practicing in North Carolina for a few years prior to making some changes in my career, but really excited to be leading the association here and helping pharmacists across the state corner to corner.
So as we wrap things up with this segment, what's the takeaway? I mean, what do you hope to see in the next 5 years? You know, down the road here, what's the grand vision, and what do you hope to see going forward?
Well, you know, I think we're sitting at it's American Pharmacist Month, and so I think plain and simple is to continue to let the public understand what a pharmacist does for them. Some of those simple questions we just talked about, but understand why and how it takes what it takes while you're waiting in line to pick up your medications, to understand that the pharmacist is there to make sure that they're properly checking not just the dose and the timing and all these kind of interactions that happen with your medications, but they're doing that for an entire community. And so I ask to maybe exercise some patience if you do see some longer lines at your local pharmacy, but understand that there's a lot being done right now through the association and through our colleagues across the state and even nationally to make your experience in a local pharmacy the best it can be.
Yeah, and I mean, when I read some of those side effects, I try not to read them. I mean, they're terrible. Well, should I read that stuff?
I think you should. Definitely, Ben. You know, some of this is to help you, empower you to learn a little bit more about the medication you're putting in your body. But the pharmacist is there to make sure you're being the most well informed about those medications you're putting in your system.
Very good. All right, what if people want more information? You know, what can they contact you, or I guess go to their pharmacist, or what about that?
Yeah, great question. You know, I think ultimately I tell people reach out to your local pharmacy, especially given the some of the concerns and constraints that we're seeing, whether that's on their website, social media, understand a little bit more about how best your pharmacist likes to hear from you, first and foremost. Now, the Tennessee Pharmacists Association, there is some more information on there as well, but for the public, but I'd say a lot of it is directed towards our members. So I usually encourage people, reach out to your local pharmacy, your local hospital, wherever you might find your local pharmacist. That's ultimately the best place to look.
All right, we will take a break. We'll come back, wrap everything up right after this.